Right now, officials in South Carolina are dealing with a growing measles outbreak. The state has now reported 138 cases. 9 more were added between Friday and Tuesday, according to the state's Department of Health. CBS News correspondent Skyler Henry has more from Greenville, South Carolina.
Yeah, some of the latest that we are hearing from health officials include the chain that is continuing to spread here in South Carolina is similar to what we're seeing in other parts of the country as it relates to this latest strain of measles, but it does not appear to have come from any sort of recent travel. People who live here in South Carolina going elsewhere across the country. Health officials indicating that most of the spread that we have seen in this latest outbreak that stems back to October coming from spread happening at churches or schools. We are seeing an increased number of people that have to either quarantine or isolate because of possible exposure to measles, and to that point, an increased number of cases, 9 new cases following the latest data that we've heard from health officials here in South Carolina. We spoke with one pediatric doctor who specializes in infectious diseases, who indicated that this is the worst that she has seen. And she has been a professional for more than 2 decades focusing in on infectious diseases. She reinforced the importance for those who are unvaccinated to take into consideration that MMR vaccine, which health officials say is the best way to prevent loved ones and those from contracting measles altogether. There is also a possibility and concern about what could be coming down the pipe as it relates to the holiday season and stretch. Kids are out of school at the end of this week, families coming together, coming from all across the country, possibly growing that spread. Health officials say that measles isn't something that is contained to a zip code or contained to a city or county. And so they say that they are concerned about the possibility of this outbreak spreading even further. We know that there are mobile vaccine units that are available upon request. There are also other communication measures to try to teach and educate people about the efficacy of vaccines all across the board, saying that they are not only available at DPH sites, but also at pharmacies. And there's also been a stress to just try to make sure that as many people are as vaccinated as possible, especially as we continue on into the winter months, because they say that the symptoms and the results of all of this could potentially result in deadly circumstances. And so they want to make sure everyone is as safe as possible. Skyler Henry, CBS News, Greenville, South Carolina.
Skyler, thank you. The concern over the rise in measles cases comes as we've seen a major shift in policies from the federal government in their recommendations for certain vaccines. Joining us now is Dr. Céline Gounder, a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, doctor, as we've seen this surge in measles cases, obviously this year, we saw a significant shift in federal policy. What have been some of the most meaningful changes?
Right, and I want to go back to what Skyler was just saying. He made a very important point, which is that these cases in South Carolina are not related to travel, which means that measles is becoming entrenched again in the United States. This has not been the case in decades. We eliminated measles in this country and actually in the Western Hemisphere. This is really backtracking, and I think that's so important for people to understand how we are setting back the clock. What we are seeing now in terms of the CDC, the FDA, the NIH, we're seeing massive budget cuts, in particular directed at infectious diseases, at surveillance, at vaccination efforts. We're seeing the administration really calling into question the effectiveness of vaccines, the safety of vaccines, and sowing doubt in people's minds as to whether they should be getting their children vaccinated. This is causing reduced uptake of vaccines. And think of it as a wildfire where you have dry brush across the country. That wildfire is going to continue to spread. That is what we are going to continue to see with measles during 2026. We've also seen this with pertussis, also known as whooping cough. And I anticipate we'll have other diseases like polio and rubella to add to the mix.
Wow. Just going to let that sink in for a second. All right. Let's move on. GLP-1, obviously huge game changer in 2025. What does it look like ahead for 2026? I mean, I know that there are some things to look at in terms of affordability. We've got the pill that could get FDA approval.
So I think the key things here are access and affordability. The group in particular that may gain more access, for whom it may be more affordable, are patients on Medicare. This is through negotiations between the Trump administration and some of the companies, but there are still going to be some out-of-pockets to pay. We are seeing more and more data showing the health benefits of GLP-1s, but you can't accrue those health benefits if you can't get the medication. I think orals will make it easier for some people to access. But big picture, there's still a lot of stigma around obesity. There's a lot of stigma around the use of these medications. And it's not just about willpower, whether you are able to keep the pounds off.
Yeah, I think the stigma part is something that we need to really attack as a society, because just as you said, it's not necessarily just about withholding and abstaining. It really is about biology. You know that more than anybody of us who understands all that. Dr. Céline Gounder, thank you.